Welcome back to Do No Harm, where we fight for patients and against identity politics in healthcare. Podcast hosts Benita Cotton-Orr and Dr. Stanley Goldfarb will highlight the medical industry's most pressing issues and dangerous trends, and discuss how we can achieve a better healthcare system for all.
We've been having some fascinating conversations over the past few podcasts, and the one thing that hasn't come up yet is how much of a role government is playing in this woke approach to healthcare. So let's talk about the current administration at the federal level and how much harm is it doing to the do no harm mandate that physicians have?
Yes, well, as we spoke earlier, do no harm has actually helped support a lawsuit against the federal government for instituting an anti-racist agenda in primary care medicine through the Medicare system. And I think that the government is supporting this approach, even though there really is no evidence that this approach is going to produce the desired outcomes, which is to reduce disparities in healthcare. And the government has decided that unless we identify all the racial characteristics of the population, so requiring new mandates about reporting by Medicare physicians about the racial composition of their practice, unless they implement these proposals to have physicians implement various anti-racist protocols in their practices, they're supporting institutions, medical schools, for example, acting in this way through grant programs that the NIH and other organizations, grant-making organizations in the federal government will support. They believe that this is the best approach to improving disparities in healthcare. They're doing this without evidence that that's in fact the case. They're doing this under the idea, well, there are disparities and we know that there's racism in America because they've decided to call every kind of disparity racist. Therefore, our approaches to eliminate bias are going to eliminate all of the disparities that occur. They have no evidence that this is true. The only evidence we have is that when we provide more healthcare, more access to healthcare, that healthcare improves, and they should do this equally for all Americans as much as can possibly be achieved. So the government is playing a very active role. There are activities that it's supported in terms of gender activities. It's come out with a presidential order that so-called gender-affirming care be supplied and that there not be any attempts at so-called conversion therapy. The governor of Pennsylvania issued an edict that was very detailed about this, for example. And yet, that leaves in the eye of the beholder what conversion therapy is. A physician who recommends that a child that seems to be interested in having a gender transition as they're defining their lives, seek psychiatric care first to be sure that there's no depression or other psychiatric problem that's underlying their decision-making, can be attacked for engaging in conversion therapy, which is obviously not true. So the government plays a huge role in healthcare. Medicare plays a huge role. It's the largest insurance company in the United States is Medicare, if one really looks at it realistically. And the government's edicts in Medicare promoting various anti-racist kinds of activities represents the government really influencing the way healthcare is going to be practiced, and in ways that's not based on scientific principles that have shown that these new initiatives are going to have any benefit at all.
So now you and I know that there's a big difference between the federal bureaucracy and the whatever administration we have at the White House level. So each White House and each president comes in with his new edicts and his new ideology. And the challenge, of course, is that generally what happens at the federal agency level is that those bureaucrats stay there. So those ideologies that are injected into that at the agency level tend not to go away. So no matter what the president says, whichever current president it is, those ideologies continue to infiltrate and permeate down the agency level and down the government level. And how do we overcome that? I mean, today the Biden administration is in there, and we find that do no harm is opposing the federal agency under the Biden administration. Who knows who will be, the next president, and what his ideology will be, maybe more progressive, perhaps less progressive. Yes. How do we have laws and regulations in place that can resist this kind of infiltration of the woke ideology?
Yeah,
what do we do?
It's a very difficult problem. There's no question about that. Fortunately, the United States, is a federation of states, and the states do also have a very important role, particularly in education, which is really under the province of states. Even though there's a federal Department of Education, I think our listeners will know that what really happens in education occurs at the state and at the local level. So we're going to have a very vigorous state agenda as well to try to influence the way healthcare is practiced, way medical education is delivered, and at the state and then ultimately at the local level. I think that what we need to do is continue to put out arguments that allow physicians and medical students and other healthcare people to understand that their views, which might be different from the so-called woke world's view, that their views are really valuable, that their views have real merit, and that their views need to be expressed as well. And when they feel that way, they'll perhaps start to have the courage to speak out as well in their organizations. When they're forced to go to implicit bias training, they'll push back and say, I've learned, I've heard, I've been to this website, I understand that there's no real evidence that this is beneficial, and that there's no real evidence that the source of the disparities that we have in our communities and healthcare outcomes are due to the way we're treating our patients. And therefore, let's stop doing this. Let's focus on the issues that really matter to us. Ideas are powerful, and ideas can win the day if the ideas are expressed honestly and persuasively, and that's our goal, is to accomplish that. But I think at the state legislative level, we're going to have some impact. But this is we need to push back against medical organizations that have a national character to them, and we have done that in Do No Harm. We've pushed back against the American Board of Internal Medicine's efforts in their foundation to support so-called woke healthcare. We've pushed back hard against them. We've pushed back hard against the AMA. We've pushed back hard against the AAMC, the Association of American Medical Colleges, which has also issued curricula that really are going to require medical schools, in order to get accredited to continue to be medical schools, to abide by these curricula that one of their governing organizations, the AAMC, support. And we've pushed back against that. So we need to continue to fight the fight. We need to fight the good fight. We need to make people understand that we are not a racist organization. We are an organization that seeks to have equitable health care for all individuals. And the best way to achieve that is to have the best health care delivered to patients, not delivered to Black patients versus white patients, or Latino patients versus Black patients, but to deliver to all patients. And that's really our goal. And we're going to do this by showing that the medical research that supports the idea that healthcare disparities are due to racist activities is flawed research, and that this research doesn't benefit patients, and that we need to speak the truth. We need to seek the truth. And the truth will be that the best way to improve healthcare for minority populations is to give them access to healthcare, not to try to change the character of the healthcare that they receive.
That's excellent. Thank you, Stan.